Hi, ladies, and welcome to Chapter 7. This is our last chapter in the book, but we're not finished with this module yet. We still have some time to actually do some review and some coding packets and to continue to work together for a little bit longer in this. But for now, I'm going to share my screen, and we're going to do Chapter 7. Oh, come on. Here we go. All right, Chapter 7, chapter-specific guidelines for chapters 15 through 21 in your ICD-10. So pregnancy, childbirth, and the Puerperium, chapter 15. I don't say Puerperium very well, Puerperium. Anyway, you guys know what it means, knows what it is. It's O00 through O9A. It's any condition that occurs during pregnancy, childbirth, or puerperium. It is a complication, unless the physician documents it's neither affects the pregnancy or is affected by the pregnancy. Chapter 15 codes are never used on the record of the newborn. Coders may find it helpful to code the mother's and the baby's records at the same time. Conditions documented on the birth certificate may appear on the newborn's record, but not the mother's record. Additional documentation to support coding may have to be obtained from the physician. So after the baby is born, you have a separate record. Sequencing priority. Chapter 15 codes have sequencing priority of codes from other chapters. Z33.1, incidental pregnancy state, is reported if the physician documents incidental status. Chapter 15 codes are only for mother's record, never the newborn's record. Routine outpatient prenatal visits with no complications are going to be Z34 category codes, and they're going to be first listed. Routine high-risk prenatal visits are going to be O09 category, first listed. Outcome of delivery. Outcome of delivery is Z37 category code, only reported once and on the mother's record. Category Z37 outcome delivery can be assigned as an additional coding to the mother's record. An outcome of delivery code should be included on every maternal record when a delivery has occurred. So there's a Z code. It's important. Why don't we label it? Trimester and time periods. Majority of codes, final character indicates the trimester. Trimester calculated from the last menstrual period with LMP, last menstrual period. First trimester, less than 14 weeks to 0. Second trimester, 14 weeks, 0 days to less than 28 weeks and 0 days. Third trimester is 28 weeks, 0 days until delivery. Peripartum, last month of pregnancy to 5 months postpartum. Oh my goodness, postpartum. Okay, we're going to get it straight, guys. Here we go. Postpartum, immediately after delivery to 6 weeks after delivery. The unspecified trimester code should rarely be reported. So when can you think of unspecified trimester code could be used? Well, what if there was a homeless lady who doesn't know she's pregnant and she's obviously pregnant and you don't know the trimester? That's when a doctor may use unspecified trimester, but that doesn't happen often. Ectopic pregnancy. Fertilized ovum implants outside the uterus. It's reported with the category O00 based on location of the pregnancy, such as ovarian or tubal, with or without intrauterine pregnancy. Complications associated with ectopic pregnancy, you're going to report category O08 codes. Hydatiform mole, tumor of the placenta, and it secretes hormones. You're going to report with category O01, report complication with category O08, malignant report D39.2. secretes hormone, chronic gonadotropic hormone, GGH. There you go. That's a mouthful, huh, guys? Hypertension in pregnancy. Pre-existing hypertension that complicates the pregnancy, delivery, or the 5-month period after birth, category 010. First listed code. Secondary code is assigned to report hypertensive heart disease or hypertensive chronic kidney disease. Fetal conditions, category 035 and 036 report fetal abnormalities that affect the care of mother. If fetal abnormality does not affect the care of the mother, do not report 035 or 036. When surgery is performed on the fetus, report a diagnosis code from category 035 to identify the fetal condition. Surgery performed in utero on the fetus is reported on the obstetric encounter. Diabetes mellitus in pregnancy. Type 1 equals little or no insulin is produced, controlled with insulin, report long-term use of insulin, which is a Z code, guys. Type 2 equals too little or the body cannot use the insulin that is being produced. It can be controlled with diet, medications, and or insulin, and you may need to report long-term use of insulin if that's what's happening. Gestational diabetes develops in 2nd or 3rd trimester in the patient who did not have diabetes prior to pregnancy. Do not report long-term use of insulin because it's gestational. Poorly controlled diabetes mellitus during pregnancy can lead to serious complications for both mother and the fetus. It could result in miscarriage or stillbirth. Certain conditions originating in the perinatal period, chapter 16. P00 to P96, chapter 16 codes are only on newborn's record. Category Z38 reports liveborn according to place of birth and the type of delivery. First listed does not report congenital malformation or deformities or abnormalities. Rather report those with Q00 through Q99. Whose record are chapter 16 codes never reported on? The maternal, the mothers. Chapter 16 codes can be reported throughout the life of the patient if the condition persists. Congenital malformations, deformation, and chromosomal abnormalities, chapter 17. Q00 through Q99 may be a first listed or a secondary diagnosis. Sequence as secondary diagnosis with category Z38 code on the initial birth record, reported whenever the condition is diagnosed. Congenital means born with. Physician must document abnormality. Okay, an anomaly is an abnormality of a structure or an organ. Congenital refers to an abnormality which a person is born. The term perinatal applies only to the baby, and the postpartum applies only to the mother. Perinatal applies to the baby, postpartum applies to the mother. Symptoms, signs, and abnormal clinical and laboratory findings, NEC chapter 18. R00 to R99. Sign equals objective evidence of the disease. Symptom is a subjective observation, is what you can see with your eyes. Report symptoms only when no more definitive diagnosis is available. For example, patient complains of pain in the right lower quadrant. Diagnosis states acute appendicitis. You do not report the symptom of pain. You report the acute appendicitis. Signs and symptom codes are used for encounters until a definitive diagnosis can be made. No specific diagnosis can be made after investigation. Signs and symptoms reported as existing at the time of the initial encounter prove to be transient or cause cannot be determined. A patient fails to return or is referred elsewhere, and all the coder has is provisional diagnoses. A more precise diagnosis is not available for any other reason. Certain symptoms that represent important problems in medical care exist, and it might be desirable to classify them in addition to the known cause. Okay, now we're going to Chapter 19, Injury, Poisoning, and Certain Other Consequences of External Causes. Chapter 19, S00 through 1088. Many of these codes have 7 characters. So you guys remember that we talked about 7 characters in our coding shout out. A, initial encounter, receiving active treatment for the injury. D, subsequent encounter, completed active treatment and is receiving routine care during healing. There's our keyword, healing. S, sequela, a direct result of injury. Add S to injury code, not the sequela code. Okay, would usually report a secondary code from Chapter 20, external cause of morbidity to indicate the injury. There are T codes that include the external cause as part of the code description. Okay, so let's talk about traumatic fractures. I'm going to take a sip, hang on. Okay, fractures not indicated as open, closed, you're going to report closed. Displaced or not displaced, you're going to report displaced. Okay, so if you're coding something and you can't ask a question and it says open, it doesn't say open or closed, you're always going to report closed. Displaced or not displaced, you're going to report displaced. Assigning of the 7th character. Now, there is more here. You know, we talked about in our little coding shout out that sometimes our blue boxes have a little more information, and in our fractures section, it does. A is initial encounter for closed fracture. B is initial encounter for open fracture. D is subsequent encounter for fracture with routine healing. G, subsequent encounter for fracture with delayed healing. K, subsequent encounter for fracture with non-union. And S is sequela. Multiple fractures sequence according to the severity. If dislocation and fracture of the same bone, you report only the fracture. Category M80 reports non-traumatic fracture for patients with osteoporosis. Even if injury by trauma, pathological fracture occurs due to disease or weakness. So why does a pathological fracture occur? It's due to disease or weakness. Let's talk about burns and corrosions. Thermal burns are from a heat source, except for a sunburn. Corrosion burns are due to chemicals. Guidelines, same for burns and corrosions. Burns are classified by depth. First, erythema. Second, blistering. Third, full thickness. Include burn codes from radiation or electricity. Current burns are classified by depth, extent, and agent. Okay, for burns and corrosions, you're going to sequence first the highest degree of burn. Multiple burns, same area, report only the highest degree burn. So if you have first, second, and third degree burns on your abdomen, you're only going to report the highest degree of burn. Infected burns use additional codes for the infection. Late effect burns report with burn or corrosion code 7th character S. Remember in our coding shout out, scar formation after a burn, that is something that happened after the burn and after the healing process. It's an after effect. It's a late effect. It's a scar. Non-healing burns are coded as acute burns. If different degrees of burns are documented at the same site, assign a code to the burns of the highest degree only. Second degree burns may also be referred to as partial thickness burns. So now we're moving on to adverse effect, poisoning, underdosing, and toxic effects. T36 through T65. Combination codes that include substance and external cause. Sequence these codes first. Follow with codes that specify nature. Do not code directly from the table of drug and chemicals. Assign a code for adverse effect when the drug was correctly prescribed or administered. So if you, the doctor gives you, let's just do Ambien for sleeping, but it makes you have episodes where you're sleepwalking. That's an adverse effect. If you take penicillin, it gives you a tummy ache. That's an adverse effect. If you take whatever drug and it gives you a rash, that's an adverse effect. Poisoning. Assign code from categories T36 to T50 poisoning codes. Report any associated intent such as accidental, intentional, etc. Report all manifestations of poisoning such as vomiting. Examples of poisoning include the key word that can be used along with the poisoning is unspecified. So let's try to code these two things. Error in drug prescription or intentional overdose. So I want you to pause the video and I want you to code these things. Coders, ready, set, code. Pause and code. So this is error in drug prescription, T50.901A. There's that seventh character. Poisoning by unspecified drugs, medicines, and biological substance, accidental. Unintentional initial encounter. Poisoning by unspecified narcotics, intentional self-harm, T40.602. I hope that you got those things right. Drug adverse effect or poisoning. Adverse effect occurs when drug is taken correctly, the patient has a negative response. Poisoning occurs when the drug is incorrectly taken. Abuse, neglect, or maltreatment. Sequence first T74 or T76. Medical documentation states abuse or neglect code as confirmed, suspected code as suspected. So you have to pay attention to your medical record. Does it say it's confirmed or it's suspected? That's going to be the difference in your code. Confirmed cases of abuse or neglect. Report an assault code X92 through Y08 to indicate the cause of the physical injury. And then you need to report a perpetrator code, Y07, and then just in that section. When suspected abuse, neglect, or maltreatment is ruled out, you're going to report Z04.71 for adult and Z0472 for a child. Again, guys, Z codes. I sure hope that you did what you were supposed to do with your Z codes. When suspected abuse, neglect, or maltreatment is ruled out, you report Z0471 for an adult, Z0472 for a child. It's there twice because it's important. External cause of morbidity, Chapter 20, and factors influencing status and contact with health services, Chapter 21. Okay, it says chapters. Well, I don't know what that means, but let me take a look at our step-by-step manual. Y'all bear with me. Didn't realize that ended so abruptly. Let's see what's on page 57. Well, I don't think that means. I do not believe that that means in our ICD-20, our step-by-step manual. So I'm just going to take a second and just see if what I need to say is. No, I think we're good. I think that that's where we can end. And please excuse this last thought. I do not know what I was meaning here. I made these about a year ago, so please excuse the incompleteness of it. Well, I hope that you learned a lot, except for that last slide that was a little iffy. I called myself going through these slides, but sometimes I guess they just really kind of elude me. I do want to just thumb through and make sure there's nothing else. I hope you guys read your information, because a lot of this, there's a lot of information. I know it's a lot. So yeah, just give me a second. I'm looking at poisoning and adverse effects, and I'm kind of just looking through the book. And we're talking about confirmed cases, complications. No, we're good. Well, okay. So I hope you guys have a good afternoon, and see you on our Zoom calls this week, or we get to code together. Bye.